Tetralogy of Fallot TOF is a congenital heart defect comprising four key abnormalities that affect the structure and function of the heart. It results in poor oxygenation of blood, leading to cyanosis, bluish discoloration of the skin and mucous membranes. It is one of the most common cyanotic congenital heart conditions. The four defects in Tetralogy of Fallot. 1. Ventricular septal defect (VSD), a hole in the wall septum between the right and left ventricles, allows oxygen-poor blood from the right ventricle and oxygen-rich blood from the left ventricle to mix. 2. Pulmonary stenosis, narrowing of the pulmonary valve or the area below it, reduces blood flow from the right ventricle to the lungs, limiting oxygenation. 3. Overriding aorta. The aorta is positioned over the ventricular septal defect, rather than just rising from the left ventricle. This allows oxygen-poor blood from the right ventricle to flow directly into the aorta. 4. Right ventricular hypertrophy. Thickening of the muscular walls of the right ventricle develops as the right ventricle works harder to pump blood through the narrowed pulmonary valve. Symptoms: cyanosis, bluish tint to the skin, lips, and nails worsens with activity or crying in infants. TET spells: sudden episodes of severe cyanosis, often triggered by crying, feeding, or exertion. Difficulty feeding and poor weight gain, common in infants with TOF. Fatigue, due to insufficient oxygen supply. Clubbing of fingers and toes. In chronic cases, the tips of fingers and toes may become rounded and enlarged. Causes and risk factors: genetic mutations or chromosomal abnormalities, e.g., DiGeorge syndrome. Maternal factors, such as diabetes, alcohol use, or infections during pregnancy, may increase risk. Diagnosis: physical exam, heart murmur detected with a stethoscope. Pulse oximetry measures oxygen levels in the blood. Chest X-ray may show a characteristic boot-shaped heart. Echocardiogram visualizes heart defects and blood flow. Cardiac catheterization provides detailed information about blood flow and pressure. Treatment 1. Surgical repair. Mainstay treatment: complete repair closes the ventricular septal defect, widens or replaces the narrowed pulmonary valve or artery, usually performed in infancy or early childhood, restores near normal oxygenation and prevents complications. Long-term follow-up is required to monitor for residual issues. 2. Temporary procedures. In very ill infants, a Blalock-Taussig shunt may be placed to improve blood flow to the lungs until complete repair is feasible. 3. Medications. Beta blockers, e.g., propranolol to prevent or manage TET spells. Prostaglandin infusions in newborns to maintain ductal blood flow until surgery. Prognosis: good outcome. With timely surgical repair, most children lead healthy lives with normal or near normal activity levels. Long-term monitoring. Regular checkups are needed to monitor for complications like arrhythmias, valve problems, or residual defects.